It's a very revolutionary space, and so we're having to contend with all these adversities and challenges. But they say that adversity is a great gateway to progress and to break the limitations of how we've practiced medicine and how we look at ourselves as we age and as we heal. So all the power to you. Can you just end this beautiful introduction of your practice and stem cell therapy with sort of a synopsis of your practice today and what you offer people and what you would like to see more prevalent in your practice as the days and months and years go by?
In my practice, I would say 75% of patients come to me because of severe health issue. So it can be a huge range, right? Starting with kids that are very young, 5 years old with autism, to people who are in their 80s with, maybe mental, with brain health issues, degenerative neurological diseases, like ALS, stroke victims. And these people they've all gone through the traditional medical therapies. They did everything the doctor told them to, and there's not enough of relief of their symptoms, and they refuse to give up, right? They are looking for hope. They're looking for more recovery. They don't want to just be, bandaged up, with symptomatic management. They want to have reversal of some of the symptoms. They want to gain more function back. So I've had people, suffering from, autoimmune diseases is a big category, lots of them. Rheumatoid arthritis, lupus, psoriasis, ulcerative colitis, Crohn's diseases, Hashimoto's. So all kinds of autoimmune issues. And people with musculoskeletal problems, sports injuries, osteoarthritis, osteoporosis, just different, tendon, ligament tears. And then there are people who are dealing with various organ diseases, heart disease, lung issues like COPD, liver cirrhosis, the kidney diseases, or even testicular issues. The brain is a huge section. So I try to educate patients on what existing research has shown. I don't speak from conjecture. I speak from research statistics. So there are a lot of research that have been done, and which is why I founded American Academy of Integrated Cell Therapy, because I wanted to educate mostly physicians on what kind of evidence there has been. Because, we can't just, talk about stem cells being wonderful. I think that's what some doctors do, but they are wonderful, but you got to speak evidence. So there are, when doctors finish the course with me, it's an online course at this point, they will take home over 300 articles categorized by, all these organ systems and disease categories. So there are a lot of research out there all around the world. But there are a lot of conditions that doesn't have research. They either are too obscure. If there's a smaller number of people who are suffering from it, usually, it's not studied very much. There's not as much incentive. Or things that just, they're not known enough about. That will include mental health issues. So there's just not enough studies on it. So I think the bottom line is there are all these conditions that has had evidence that stem cell therapy can be very helpful for. And then I have patients who come to me with no particular ailments. They may be fairly healthy. They're going through the normal aging process. The age range is, about, late 30s to all the way to, to their 80s. So these are people who are motivated to stay healthy, stay young, stay vibrant, and they come to me to do regular stem cell treatment just to be on top of their game, right? Or people who are aging, they have some aches and pains, but they don't have a diagnosis, but they want to have a better life. A lot of our retirees, they've made their contribution, worked hard, made money, but now they're supposed to enjoy life, and then they got all these aches and pains, and it's not as fun. So what's all that money for? So that's kind of the population, different two populations I have. My hope is that more and more people are just going to come to me for anti-aging purposes, right? So they never get sick. And there's a statistic: if you can reverse people's biological age by 7 years, then you're cutting down chronic diseases by 50%. So if we can keep people younger biologically, then they're less sick. Imagine 50% of chronic suffering are gone. So if I can keep people healthier, that will be much better, right, for everybody. But in the meantime, illness, diseases, that's a human condition. I'm always here to help. And, I've definitely offered a lot of hope to a lot of people and real solid results. And very privileged to be able to do all that.